हेलो अस्सलाम वालेकुम।
वालेकुम अस्सलाम सर।
तो इस भाई अभी शुरू करें, कुछ टाइम बाकी है।
सर बस 1 मिनट बाद आप शुरू कर सकते हैं।
अभी शुरू करें।
जी सर, स्टार्ट कर सकते हैं।
बिस्मिल्लाहिर्रहमानिर्रहीम। Dear students, I am Professor Dr. Murad Zafar Mari, Professor of Forensic Medicine. Uh, Today's lecture is thoracic cage injuries in context of forensic medicine. What is forensic medicine? The medical definition of the forensic medicine is the branch of medicine dealing with the application of medical knowledge to establish facts in civil and criminal legal cases, such as investigation into the cause of time of his death and also the time of injury and causative weapons used in the injury. There are three in forensic medicine. We can say that there are three threats to life. One is disease, other is the injury, external injury or internal injury, and the poisoning, which is called toxic substances, and the knowledge is known as the forensic toxicology. So basically, forensic medicine and toxicology is a medical subject which uh, you go in detail in your third years, but for an introduction purpose, you first year students today learn about the chest, thoracic cage, and something about its chest. Thoracic cage composed of thoracic vertebra, ribs, sternum, and costal cartilage, form a protective cage around the organs of the thorax, which include heart, lung, blood vessels, supports the shoulder girdle and upper limbs. It provides attachment points for the muscles of the neck, back, chest, and shoulders. Injury to the thorax. The relationship of pleural cavities, lung, heart, mediastinum, and diaphragm is depicted. From the forensic point of view, the spleen and the most of the liver and stomach are the major organs in the abdomen. Thoracic organs lie largely beneath the costal margins. They are vulnerable to both stabbing and blunt injury to the chest. You can see here the organs which are situated in the thoracic cage, heart, lungs, and the blood vessels, major blood vessels going through to the other parts of the body. The structures of thoracic and neck are visible here. In case of injury, the impact of the injury involves the organs and cause wounds. Chest injuries are always a great challenge for medical professionals as the two of the vital organs, which are the vital organs situated in the chest. One is the heart and other is the lung. In the body, there are three vital organs which are very essential for life. One is brain and the two are the heart and lung. Which are lung and heart are present in chest, and any injury causing damage leads to excessive bleeding and death of the person. These injuries are usually caused by blunt force or sharp penetrating weapons. Injuries to the chest wall. Outside of the chest, that is the skin and the chest wall, which consists of skin, muscle, fascia, and the ribs. The integrity can be compromised either by severe mechanical failure of the rib cage or by the penetration of the pleural cavities. Fracture of ribs are common but do not greatly impair respiration unless they are numerous and they prevent expansion of the thorax. Broken ends of the rib penetrate the pleura and lungs. Irregular and muscular pain limit respiratory effects. सांस लेना दोबर हो जाता है, रेस्पिरेशन डिफिकल्ट हो जाती है और penetrating injuries, especially by knife to the lower wall of thorax, may enter the peritoneal cavity as well as the pleural spaces, perforating diaphragm, stomach and heart. ये chest injuries की बात आपको बताई गई है. ये penetrating injuries कौन सी होती हैं? Especially knife टाइप की शार्प फोर्स हो या ऐसी गलत वेपन हो जो पेनिट्रेट करके चेस्ट में जाए, वो जो है लंग्स और हार्ट को इन्वॉल्व करते हैं. चेस्ट ट्रॉमा की अगर हम बात करें तो चेस्ट ट्रॉमा is also a word used for the injury. Trauma is often sudden and dramatic. एक्सीडेंट हो गया, रोड ट्रैफिक एक्सीडेंट है, लड़ाई झगड़ा है, फाइटिंग है, इसमें जो है चेस्ट की इन्वॉल्वमेंट हो जाए. It accounts for the 21% of the all trauma deaths. Two-thirds of deaths occur after reaching hospital. Serious pathological consequences which are hypoxia, hypovolemia, myocardial infarction that lead to the death. The most common type of injury is the blood. Mostly जो है ये एक्सीडेंट में, लड़ाई झगड़े में, फाइटिंग में, बलन हार्ट ऑब्जेक्ट वो चेस्ट इंजरी होती है. एनाटॉमिकल इंजरीज को अगर हम उसको डिवाइड करके देखेंगे तो thoracic के mainly skeletal part of the thorax, cardiovascular जिसमें हार्ट और उसके ब्लड वेसल्स आ जाते हैं, प्लूरल एंड पल्मोनरी लंग्स और लंग्स की जो ब्रांचेस है वो आ जाते हैं, मेडिस्टर्नल पार्ट आ जाती है, डायफ्राम जो रेस्पिरेशन में मदद देती है और जो पार्टीशन बनाती है बिटवीन चेस्ट एंड द एब्डोमेन, एसोफेजियल जो है डाइजेस्टिव सिस्टम के साथ कंसर्न है, और पेनिट्रेटिंग कार्डियक एनी टाइप ऑफ इंजरी टू द कार्डियक एरिया. Main causes of the chest trauma are the blunt trauma, blunt force to the chest, penetrating trauma, projectile that enters chest causing small or large hole, compression injury, chest is caught between two objects and chest is compressed. Now we discuss a type of injury of the chest which is called flail chest. Flail chest is an injury that occurs typically following a blunt trauma to the chest. Inspiration, expiration both becomes difficult when three or more ribs in a row have multiple fractures within each rib. It can cause a part of the chest wall to become separated and out of from the rest of the chest wall. इस तरह जो है वो डिफरेंट पार्ट्स रिब्स के बंद होते हैं और रिब्स टूट जाते हैं, जिससे जो है रेस्पिरेशन और इंस्पायरेशन डिफिकल्ट हो जाती है. क्लिनिकली साइंस क्या होते हैं? डिस्निया कैन अकर, टेकिनिया, hypotension can occur, tachycardia occurs, chest wall bruising occurs, 50% hemoptysis occurs. These are creps. You can listen, and hypercarbon oxide gas accumulation occurs. Trauma, chest wall, these are the different parts. Again, you will see these are the motor vehicle accidents with chest trauma occurs. Penetrating trauma can occur from the knife or any sharp edge weapons. Additional information about the chest injury is any mechanical or violent injury called chest injury, pathology or some type of the diseases occur in the chest, lung, heart, involving the heart. Toxic or chemical substance can also injure the lungs or heart. Environmental situation, bad environmental pollution, they can affect the lungs. Any other traumatic or positional or postural position can affect the lung, and some treatment side, iatrogenic injuries can occur during the treatment of any person. Mechanical asphyxia is the failure of the oxygen transportation, for example, carbon monoxide, poisoning, accumulation of the carbon monoxide in the lungs, or failure of the oxygen utilization. For example, cyanide poisoning may. Pathological asphyxia, entry of oxygen to the lung is prevented by the disease of the upper respiratory tract or lungs, like in laryngeal edema, spasm, tumor, or abscess. In these cases, oxygen entry into the lung is prevented. Toxic or chemical asphyxia, cessation of the respiratory movement due to paralysis of the respiratory center and poisoning with morphine, barbiturates, or strychnines, inhibition of oxidative processes in the tissues, preventing the use of oxygen in the blood, cyanide poisoning. Environmental asphyxia, breathing in vitiated atmosphere with bad atmosphere, as in uh, that will, in severe cases, that injure the lung and the blood vessels. Traumatic asphyxia. Here are fighting in cases of the fighting, person had to eat the thorax may result in pneumothorax. Pneumothorax are pulmonary embolism that will interfere with the oxygenation and ventilation by compressing otherwise healthy parenchyma. Expire respiratory movements and thus preventive inspiration, manner of death, accidental, homicidal occurs. Classic signs of the asphyxia are marked in cases of traumatic asphyxia. How can traumatic asphyxia occur? The mechanism of injury in traumatic asphyxia is usually a crush by an object that compresses the chest or upper abdomen. It is most commonly seen in motor vehicle collisions in which victims are ejected from vehicles that subsequently roll over their torso. जो एक्सीडेंट में भाग होते हैं पर्सन और एक्सीडेंट होते हैं और गाड़ियां जो हैं वो रोल ओवर होती हैं एक दूसरे के साथ मल्टीपल जो है व्हीकल्स आपस में कोलिजन करते हैं तो पर्सन को बहुत सारे इंजरीज मिलते हैं. Injuries of the lung. Any substantial impact of the chest can contude the lungs of the surface or deeper parts. This may be when the area of the impact or counter to damage on the opposite surface. Deceleration injuries are seen in falls and traffic accidents, mostly along the posterior lateral surface where a vertical line of subpelvic pulsing occurs. Often in the paravertebral gutter, the outline of the ribs may be imprinted in the contusion on the pleural surface of the lung. Bruising may cause subpleural blisters, which may rupture to release blood or air into the pleural cavities. Injuries of the heart. A common form of homicide is a stab wound. Homicide is referred as killing of a human being by an other human being. The entry point may be anywhere over the pericardium, adjacent areas, sternum is penetrated. Most stab wounds are sharp wounds, intercostal spaces through a rib or costal cartilage. Traumatic asphyxia is other type is the overlying definition. It is defined as it is a mechanical anoxic death due to mechanical pressure by a heavy object on the chest with or without abdominal compression leading to prevention of respiratory movements. आप तस्वीर में देख सकते हैं ये छोटे बच्चे जो हैं वो ओवर नीचे करके जो है बिस्तर पे लेटे और तो उनकी वजह से सांस में डिफिकल्टी इन ब्रीदिंग हो जाती है और इसी तरह बड़ों में भी और ये बड़ों के साथ जो छोटे बच्चे लेटते हैं तो अक्सर जो है बड़े जो है वो छोटे बच्चों के ऊपर ओवरलाइन होते हैं तो समटाइम्स जो है उनकी रेस्पिरेशन प्रिवेंशन हो जाती है और रेस्पिरेटरी मूवमेंट्स बंद हो जाते हैं दैट विल cause to the lead to the death. Overlying of the infants, again you can see in this picture, infant found dead in morning in the maternal bed, sudden infant death syndrome, are the type of the positional or postural asphyxia. Asphyxia is a term which is used for the lack of oxygenation to the body. Again, you see the picture showing prevention of the oxygenations and prevention of the respiratory movements that will lead to the the prone position and the stoppage of the respiratory movements of the person and lead to the coma and death. Severe and sudden compression of the thorax causes a rapid increase in the pressure in the chest. Sternum and अगर अब हम उसको conclude करने की तरफ जा रहे हैं तो severe and sudden compression of the thorax causes a rapid increase in the pressure in the chest. Sternum and ribs severely compresses the heart and lungs, causes a backflow of the blood from the right ventricle into the head, shoulder, and the chest. Signs symptoms are the bluish and purple discoloration of the face, head, neck, and shoulders, and cyanotic face and swollen tongue and lips, bleeding of the conjunctiva. Traumatic asphyxia leads to the sharp, distended neck veins, cyanosis, subconjunctival hemorrhage, broken blood vessels in the eyes, black eyes, fatigue of the head and neck, pinpoint red spot. These are the symptoms which can occur when the respiratory system is involved. Autopsy findings and postmortem findings में क्या देखते हैं? Externally, signs of the asphyxia and line of the demarcations are present. Internally, signs of the asphyxia and the lungs are usually dark and heavy. Autopsy findings in traumatic asphyxia, general appearance of the victim showing oasis congestion of the face. Here you can see the congestion and cyanosis on the face and the body areas. And examining of the eye, petechiae observed in the left upper conjunctiva. Here you can see the spars, which are clotted blood. Autopsy findings, traumatic asphyxia, multiple fractures of the rib accompanying the bleeding in the surroundings of tissue, and right first row 4 ribs and left first 9th ribs. ये autopsy findings है जो postmortem करते हैं और asphyxial death को जो है postmortem करके cause of death determine करने की कोशिश करते हैं. तो चेस्ट को खोल लेते हैं तो इस तरह की जो है पिक्चर नजर आ जाती है. थैंक यू वेरी मच. एनी क्वेश्चन? फर्स्ट ईयर स्टूडेंट्स forensic medicine teaching, you can learn forensic medicine from the book of the forensic medicine. And today's lecture will be easy for you when you learn forensic medicine textbook. The contents of today's lecture will be better explainable when you, the students, open the forensic medicine book and learn about the chest trauma and asphyxia, different forms of the asphyxia and anatomy and physiology accordingly. Physiology, anatomy के बाद जो है पढ़ने के बाद आपको फोरेंसिक मेडिसिन की आज के लेक्चर की जो बादियत है, बेनिफिट है, वो आपको फोरेंसिक मेडिसिन की बुक टेक्स्ट बुक लेंगे तो वो पढ़ने के बाद आपको बेहतर उसकी अंडरस्टैंडिंग हो. एनी क्वेश्चन डियर स्टूडेंट्स? ये स्टूडेंट्स कोई भी क्वेश्चन हो आप मुझे पोस्ट कर सकते हैं. आप पोस्ट करके भी पूछ सकते हैं अपना क्वेश्चन और पर्सनली भी आप पूछ सकते हैं. डिपार्टमेंट से भी आप जो है रिव्यू कर सकते हैं.